Hello everyone, I am Dr. Yogesh Patil, Senior Vitreoretina Surgeon at Advance Eye Hospital, a branch of Agarwal Eye Care System in Sanpada in Navi Mumbai. So today we are going to discuss on a very important topic of aging and its associated important retina problem called as an macular degeneration. First question which is asked by everyone to me or by all my patients to me is why aging is associated with macular degeneration. So the first important factor is the way we have a digestive power of the stomach, we also have a digestive power in the retina. We call it as a metabolic activity. So this digestive power goes down, certain unwanted substances starts getting accumulated in the center part of the retina, leading to the macular degeneration. Second important cause where retina problems are associated with aging is associated systemic diseases like blood pressure, diabetes mellitus and raised cholesterol level. Along with that, in earlier life, if you are associated with extensive working in the sunlight or excessive exposure to the UV rays, has been recorded an increased incidence of macular degeneration in such patients. So second common question asked is, what are the types of macular degeneration? So broadly there are two types of macular degeneration called as an dry macular degeneration and the wet macular degeneration. So as we already discussed, because of the decreased digestive power of the retina, certain unwanted substances, particularly what we call as an drusenses as seen in this image, starts getting deposited in the central part of the retina, where we call this condition as an dry macular degeneration. Further progression of this disease or in the advanced stages, the condition is associated with bleeding within the center part of the retina or swelling in your center part of the retina as seen in this image. We call it as an wet macular degeneration, also known as CNVM. What kind of symptoms we see in a patient associated with macular degeneration? So the most common symptom or a complaint with which patients comes to me is his inability to do the reading. Another complaint is I am frequently changing my reading glasses and still I am unable to read properly or work for the closer distances. So this is the usual complaint in the patients who have a dry macular degeneration. And this reading difficulty keeps on progressing slowly over a period of time. In people who have a wet macular degeneration or a CNVM, the complaints are more sudden in onset. So they will say ki yesterday I was absolutely fine and suddenly I am seeing everything blurred, or there is a huge black spot in front of my eye, or images whatever I am seeing with that particular eye are distorted as seen over here. These are the common symptoms seen in these kind of patients. So coming to the last part of this discussion regarding the treatment. So treatment part, I will be dividing into the two parts. Like once you are diagnosed with this conditions, you will be undergoing certain set of investigation, mainly the two commonly called as an OCT and FFA. So OCT is done on this machine. It is a non-invasive scan of the center part of your retina. Very important for us to detect whether it is a dry ARMD or this is a wet ARMD depending upon scan we see on the machine. Second commonly performed test is called as an FFA, or in a layman's language we call it as an retinal angiography, where a dye will be given in one of the peripheral blood vessel under supervision of the anesthetic after checking allergic tendency to the dye, after checking your blood pressure. We take the serial photographs of your retina and it shows us the extent of your disease and the location of the disease. Coming to the treatment part, the dry degenerations are usually treated with the help of certain kind of tablets or a medicine called as an antioxidant. They help us to reduce the progression of the disease. Whereas in wet degeneration, or what we call it as an CNVM, you will have to undergo monthly injection in the inner part of the eye. We call it as an intravitreal injection, as shown in this video. The procedure is done under the topical anesthesia. Hardly takes around 1 minute's time. absolutely painless because it is done under the topical anesthesia. Many a times these kind of an injections needs to be repeated at monthly interval till you are completely cured of the disease, usually for 3 to 5 months. Hope this video helps to solve a lot of queries of the patient who have macular degeneration and their relatives. For further doubts, any clarification needed, you can always contact on the further address or on my email address.